All right. Welcome and thank you for joining. My name is Ashley Lusick, and I am a health educator for community health at Atlantic Health System. Today's webinar, Spring into Sports, What You Need to Know to Participate Safely in Sports and Exercise, is presented by Dr. Timothy O'Sullivan of Atlantic Medical Group Orthopedics at Wayne. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try and get through all questions at the end of this presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these programs and these groups or other resources or any additional dates and times, please call 1-844-472-8499. The first step to a healthier heart is knowing your risk level for heart disease. Take 2 minutes to complete our online quiz and get your individual results. Thank you, everyone. And I am now going to turn things over to Dr. O'Sullivan.
Thank you for that introduction. I'm Dr. Timothy O'Sullivan. I work out of the Atlantic Sports Health Orthopedics in Wayne. We wanted to discuss with you all today this topic. It's very important now that we are entering the spring season when people are getting a lot more active. Our topic today is Spring into Sports, what you need to know to participate safely in sports and exercise. So some of the goals, things that we want you to be able to know by the end of the lecture are, being able to answer these questions. And we will go through them in section by section to make sure that we are able to take away something from this lecture. Everyone's coming in with different levels of knowledge. So if you can at least leave this lecture with with something from it, that would be good. So the first question is, what is exercise? So we'll go over the definitions of different types of exercise. Who should exercise? We'll talk about different groups of people that should be, participating in exercise. Why should I exercise? So we'll go over, what types of benefits there are to exercise. How should I exercise? So ways that we want to increase our activity and exercise and sport. And how to exercise safely. So how can we participate in sport and exercise without having increased risk of things like injuries or problems with the heart and lungs? So first, what is exercise? We'll define some terms in this section. Aerobic activity is the activity in which the body's large muscle groups move in a rhythmic manner in order to for a sustained period of time. Some of the most common examples of these would be brisk walking, running or jogging, swimming, bicycling. These are also known as endurance activities, or people just refer to it as cardio for short. The 3 components to aerobic exercise are going to be intensity, frequency, and duration. So intensity is how hard you're working when you're doing this activity. There's 3 intensities that we'll go over on the next slide. They are mild, moderate, and vigorous. The frequency is how often someone does this aerobic activity. And the duration is how long you do that activity in any one given session. So the aerobic exercise intensity, again, is most commonly split up into thirds: the light intensity, moderate intensity, and vigorous intensity. There's some terms within this that we need to talk about. One is MET. MET is metabolic equivalent. It's the energy that you use when you're resting or sitting still. And we use this kind of as a baseline as we define light, moderate, and vigorous. Light intensity is defined as anything that's less than 3 of those metabolic equivalents. For instance, if something is a metabolic equivalent of 3, it means that you're using 3 times the amount of energy you would be doing if you were resting or sitting still. Some examples of light intensity aerobic exercise are things like slow walking, cooking, doing household chores. Moderate intensity is between 3 and just below 6 METs. That's brisk walking, doubles tennis, raking the yard, things like this. Vigorous intensity is once you get 6 and above. So that's running, shoveling heavy snow, carrying heavy grocery bags up the stairs. Another way that we talk about intensity is not necessarily using METs, but is talking about more from a perceived kind of exertion. And we talk about the talk test, kind of a rule of thumb that we use, that if you are able to talk but not sing during an activity, we usually refer to this as moderate intensity exercise. Whereas if you are at the point where you can't say more than a few words without having to take a breath, that would fall more under the vigorous intensity for aerobic exercise. Muscle strengthening, another type of activity that we do that helps to increase the skeletal muscle mass, power, and endurance. Common examples would be, of course, lifting weights, using resistance bands, body weight exercises such as bridges, push-ups, dips. That also falls under muscle strengthening, and carrying heavy loads. It's important to remember too that you can sometimes have overlap. So if you were doing things like squats or bridges or any of these muscle strengthening activities a lot in a row, such that you were getting some of that aerobic exercise, there is some overlap sometimes where muscle strengthening can also overlap with aerobic exercise. This has 3 components as well. Intensity, again, is going to be the weight or force that you're using. Frequency is how often you're doing that activity, and then sets and repetition, or how many times you do this. So repetitions would be the number of times that you're doing that certain lift or movement. And then once you complete a certain number of repetitions and take a break, that would be a set. Bone strengthening. This is activity that helps produce an impact or a force on the bones that help promote growth and strength of the bone. People talk about weight-bearing activities. They're talking about this, the bone strengthening type activities. So running, jumping, lifting weights all falls under bone strengthening. And you can see that, again, there's overlap between aerobic activities like running with this bone strengthening activities, lifting weights like we talked about for muscle strengthening. Again, that also falls under bone strengthening as well. In terms of balance, that's another type of activity. This is helping us reduce the risk of falls. Things like walking backwards using a wobble board, standing on one leg. You can see this little girl surfing. All of these things help us to resist those outside forces that are trying to push us over and cause falls. And lastly, flexibility is another type of activity that is important to our overall fitness. This is kind of the activities that we do to increase the range of motion of a joint. Yoga and stretching being 2 of the most common ones. So now I'll talk about who should exercise. And the answer is pretty simple and straightforward. It's pretty much everyone. There's very rare instances in which someone should not participate in exercise. The vast majority of the general population, exercise is going to be safe and healthy for you to do. So children, adolescents, adults, or older adults, those that have any medical comorbidities, anyone with disabilities, and even pregnant women, everyone should be participating at some level in physical activity, exercise, or sport. Now, why should I exercise? There's a lot of benefits to exercise. When we talk about some of the benefits that we'll share in a minute, this was mostly looked at, these benefits from exercise, originally looking at the marker of 150 minutes per week of that moderate intensity aerobic exercise. Again, the moderate intensity being the level where you can talk but not sing when you're doing your activity. These getting to this level of 150 minutes per week does reduce the risk consistently of many chronic diseases, which we'll go into a little bit more detail coming up. Those that did higher intensity, greater frequency, or longer duration exercise did see additional benefits. These benefits are seen in all ages, all races, able-bodied, disabled, chronic conditions, whatever it may be. Everyone saw benefit with moderate intensity aerobic activity. And what's been coming out that's newer in terms of our understanding of the benefits of exercise is that these benefits start to accumulate with any amount of this moderate or up to vigorous intensity physical activity. So some exercise is better than none. That's one of those take homes that is very important for us to remember, is that we do get benefits starting at that lower end of the scale. Even if you can't get up to 150 minutes of moderate intensity aerobic exercise per week for whatever it may be, it's a long week, you don't have the time that week, whatever, the reason, doing something is better than doing nothing. We do see evidence of those improvements. And in general, these benefits do outweigh any risk of injury. We'll talk a little bit more towards the end about, what risks there can be associated with exercise. But in general, as long as you have a discussion with your physician, if you have any of these certain, heart conditions, that sort of thing, they'll just help you set up some goals for heart rate and blood pressure for you specifically that would be safe. I don't like to usually put in a lot of numbers or graphs or that kind of hard data, but this I wanted to include because it's very important, because it's just a visual representation. You can see that there is no lower threshold for benefit. Along this bottom axis here is the amount of physical activity. So going towards the 30, this is more of those metabolic, those met hours per week. And the hazard ratio of mortality, the higher up here means the more likelihood of a poor outcome. And so you can see as soon as you start doing some exercise, you can see how steep that slope is, that early benefit that we see, that you don't necessarily get up to the, target of 150 to 300 minutes of those moderate aerobic exercise, that even early on, there's a very steep slope, a very large effect to reduce risk of these medical illnesses and death. So there are plenty of benefits of exercise, and some of them occur pretty much immediately. Reduced feelings of anxiety, reduced blood pressure, improvements in sleep, and improved insulin sensitivity are a few of those immediate effects and benefits from exercise. In regards to certain populations, such as children and adolescents, they typically see improved bone health, improved weight status, better fitness, both in the cardiorespiratory, so how their ability to perform these type of exercises, as well as musculoskeletal fitness, so how their muscles are able to produce power, strength, and endurance. They see improved cognition as well, which they've shown both academic achievement tests improvement in their grades, as well as things like memory. And those children and adolescents that exercise also have a decreased or reduced risk of depression. And now for adults and older adults, this is typically a big no-no giving a presentation, a big wall of text like this, but I wanted to lay it out like this just so you can see the ridiculous amount of advantages to this benefit of exercise. It's not like any one particular of these benefits is something that needs to be highlighted. It's just the massive amount of benefits that I wanted to highlight here by putting them all up here at once. So in addition to some of those benefits that those children were seeing, such as reduced risk of depression, reduced improved bone health, things like that. In our adults, they're also seeing lower risk of all-cause mortality. So that being a marker for, reduced risk of dying due to, again, things like cardiovascular disease, hypertension, stroke, diabetes, low risk of that, low risk in some of getting some cancers as well. Just like in the children, we see improved cognition, so improved memory, processing speed, things of that nature, reduced risk of dementia. In our older adults, they fall less. That leads to, of course, reduced risk of fall-related injuries, which are very important because our bone health is very important. And as we age, sometimes our bones are not as strong, and fall-related injuries such as breaking a hip in an older adult is a very serious problem that has a lot of mortality associated with it. and some disease-specific areas that they've seen benefits. They've looked at cancer survivors as a whole and saw improvements in their quality of life. And within those groups, they looked at specifically breast cancer, colorectal cancer, prostate cancer, and each of them had, in some cases, lower risk of dying from that specific cancer. Osteoarthritis, this is very common. People with hip and knee arthritis, they saw that those that were exercising and reaching that moderate intensity exercise that we're looking for, we're having decreased pain, we're having improved physical function, and they didn't see any progression of those diseases at those recommended levels, so not progressing their arthritis. And again, the common things like the high blood pressure, the diabetes, we see reduced risk and reduced and better outcomes in those that are exercising, better control of the diabetes and hypertension. And then those that have spinal cord injuries, disorders that impair their cognitive function, multiple sclerosis, we see improves in walking and physical function. These benefits of exercise extend also to pregnant women and postpartum women. I know there's sometimes some concern about exercise and physical activity during pregnancy. We'll discuss that in a little bit more detail later, but the benefits you can see here are that it reduces the risk of excessive weight gain and gestational diabetes. And gestational diabetes is important because that can cause high birth weights in infants, and high birth weights in infants have their own risks associated with that. In the postpartum period, we see that it decreases the symptoms of postpartum depression, and it can help return to pre-pregnancy body weight. So now that we've gone through that laundry list essentially of benefits that we see from exercise, the next question really is, how should I exercise? There are some general guidelines that a number of groups have proposed. Some of them are through the American College of Sports Medicine. Some of them are through the CDC, and the consensus is regarding, as we discussed before, that 150 minutes of moderate intensity aerobic exercise. The caveat is that those that have the cardiovascular fitness to perform that more vigorous intensity aerobic exercise will see similar benefits at about basically half of the time spent, at 75 minutes of that vigorous intensity aerobic exercise. But as we'll discuss later, you don't need to achieve that vigorous intensity aerobic exercise, especially if you are not at that point in your fitness career, that you can achieve that without causing undue stress on the muscles and tendons and bones and all of that. In our adults, it's not just the aerobic exercise that's important. It's also important to do muscle strengthening activities 2 or more days a week. We see additional health benefits doing those muscle strengthening activities. And we should really be moving more and sitting less throughout the day. Some physical activity is better than none, as we discussed before. And it's very important, especially as Americans. Our percentages of those that hit the recommended amount of physical activity is unfortunately well below what we're shooting for. And I have to admit that I fall victim to that too. I have not gotten up to the amount of exercise that I need to do either. In addition to the guidelines for adults, the older adult population, there's some additional guidelines for them. One of these that's very important, as we discussed earlier, is reducing our risk of falls. So in that way, we need to make sure that our older adults are adding some balance activities as well. So those balance training activities, in addition to those aerobic and muscle strengthening activities, are going to be very important. And again, it's important to determine what is a good amount of physical activity for you on an individual basis when we talk about the light, moderate, and vigorous physical activity. So we'll talk again a little bit later about how we can build up to a safe amount of activity But especially in our older adults, sometimes it can take them a little bit longer to build up that endurance to get to the point where they can perform that moderate intensity physical activity. In our pregnant and postpartum women, the same rules apply about trying to achieve 150 minutes of moderate intensity physical activity. In addition, the use of your physician to guide you can be important if you have any specific risk factors related to your pregnancy, such as eclampsia or preeclampsia, so any issues with blood pressure. But otherwise, in the average healthy pregnant woman, there are no additional restrictions from a moderate intensity standpoint. That still would be the goal. And in those with chronic health conditions and disabilities, same idea. The goal is still that 150 moderate intensity per week with the muscle strengthening activities. So how do I exercise safely? So there are a number of ways in which we try to help prevent injury. And first, we need to know kind of what is the risk? What are we trying to prevent? So some of the things that we worry about when we talk about introducing either new activities or becoming more active are things like musculoskeletal injuries. This is the most common. This is, when you're talking to your friend and they say, oh, I was playing pickleball the other day and now my knee hurts, or I was, running and then I felt a pop in my calf. These injuries that we pick up are the most common type of injury you'll see compared to things like cardiovascular injury. The musculoskeletal is certainly more common, but they're still overall relatively rare. So only one injury on average occurs per 1,000 hours of walking for exercise and less than 4 for every 1,000 hours of running. The risk of injury does increase with the total amount of physical activity you're doing, but those that are less fit are more likely to be injured. So it is one of those things that as you're exercising more, the total amount of risk can increase because you are doing more activity, but as your body adapts, that risk then decreases. Participation in any collision or impact sports, there is of course a higher risk associated with this. So things like football, basketball, and depending really how you or your friends or whoever plays any sport can turn, unfortunately, any sport into a collision sport, depending on how aggressive all the participants are. But the collision sports that we typically think of, such as football, basketball, martial arts, any of those, there is a higher risk of injury and specific types of injuries as well, things like concussion or fracture. Past injury does increase your injury risk of that body part. So those that have had, for instance, a muscle strain of the hamstring or whatever it may be in the past, they do have a slight increased risk of re-injuring that. But making sure that we're slowly adapting to an increase or a new activity is a way of preventing re-injury. And then performing a variety of different physical activities can reduce the risk of an overuse injury. So these types of overuse injuries we commonly see in our pediatric population, those pitchers, what they call the little league elbow, how they're throwing too many pitches for their body, that it's an overuse of that portion of the elbow there, and making sure that we're not getting too sport specific especially at a young age is important as well, because this kind of cross training or playing a variety of sports and activities helps kind of prevent overuse of certain either muscle groups or tendons. So some of the best strategies to avoid musculoskeletal injury is trying to be regularly physically active to increase your physical fitness. This physical fitness helps your body adapt to minimize the risk of injury. And we want to increase this physical activity gradually over time. Usually when we talk about this, we say if we're introducing ourselves to a new sport or activity or weightlifting or running like certain distances and time, we try to increase that usually by about 10% or so per week. And that's a general rule of thumb. Everyone's a little bit different. We do see in our older population that sometimes they need to maybe increase that a little bit slower. But that gradual increase over time allows the body to adapt to any overload to prevent any risk of injury. Performing moderate intensity, low impact, non-contact exercises helps reduce that risk as well. The low impact here is talking about the impact with the ground. So running would be high impact, jumping would be high impact. The lower impact things like the bicycling, the swimming, the golf, all of those are going to have lower injury rates. Besides musculoskeletal injuries, people also worry about, cardiac events, things like heart attack. These are very rare, especially if someone has no predisposing, history or factors or anything like that. The risk that we see most commonly is when someone that is typically very inactive then becomes much more active than usual. So a classic example of this would be someone that typically doesn't do any exercise at all, and then there's a big snowstorm that comes through, and now they're engaging in vigorous intensity activity by shoveling this, heavy, wet, heavy snow. That's where that risk is greater. And the trick with that is oftentimes we don't think of it as, exercise, but it is vigorous intensity exercise. In general, healthy people participating in moderate intensity physical activity, there's very low risk of an adverse event with that. If you are like that person in the example who typically doesn't do anything and you want to get more active, there's different ways to kind of introduce exercise in a safer way. So again, it's kind of that start low, go slow type of method, starting with light to moderate intensity activity, such as walking 5 to 15 minutes at a time. And again, remembering for moderate, our kind of rule of thumb is if you're walking and you are able to speak but not sing, that would be moderate intensity activity. If you're walking very slowly, that would count more as that, light. You would do that a couple times a week, and then you would avoid that vigorous intensity activity like we were talking about, like shoveling heavy snow or running. What we would want to do first is increase the duration or the number of minutes per session that you're doing, as well as the frequency or the number of days per week. And these are the ones that you increase first before you would increase the intensity. And again, this is our way of allowing the body to adapt to these changes in a way that won't potentially cause overload or injury of the muscles, the bones, the tendons. And as we talked about before, increasing by about 10% per week is a general good rule of thumb. Well, we're all a little bit different. So some of the older folks, we got to go a little bit slower to make sure that we're not setting ourselves up for an injury. In regards to those who are pregnant, the additional risks are more for specific types of activities. So one is that if you are after the first trimester of pregnancy, you should be avoiding activities that involve laying on your back, because this can restrict blood flow to the uterus and fetus. It's the same concept behind when the OBGYN advises you to not lay flat when you're sleeping. Obviously, they should also avoid any collision sports or anything that has a risk for abdominal trauma or falls. So skiing, there can be sometimes controversy over whether or not this counts, but unfortunately, in general, some falls and injuries from skiing often happen from other people, not things that are out of your control. So that's why sometimes people advise you to avoid skiing, because you may be a very safe skier, very slow skier, that sort of thing, but somebody can come out of nowhere and crash into you. In terms of performing moderate intensity activity, the risks in a healthy woman who are pregnant are very low. There's no increased risk of things like low birth weight, preterm delivery, or early pregnancy loss. And there does not, we don't see any adverse effects on things like breast milk, volume, composition, or infant growth. In our patients with arthritis, in general, those that see changes and risk of arthritis developing are those that are doing very high levels of high impact physical activity, such as our professional level athletes. And that's mostly due to the risk of injury that's involved in competing. Because when we have injuries, especially fractures of the bone or injuries to the tendon and where they attach to the bone, and how that changes the mechanics, the biomechanics on these joints, the knee and the hip. We can see some either post-traumatic arthritis or these increased long-term stress being put through these joints have increased chance for arthritis. But that is, again, only for those very high level, high impact physical activity. For those that have arthritis already, your moderate intensity physical activity for 150 minutes a week or more is generally not going to cause increase in arthritis in the knee or the hip. People have looked at up to 10,000 steps per day. Doesn't worsen the progression of arthritis as long as you're following those low impact, avoiding those painful exercises. It has low risk of a joint injury. So things that we like the most for those with arthritis are going to be things like swimming, water aerobics, those things that have that are low impact, not the running, jumping type activities. Muscle strengthening exercises, as we discussed before, is always important for bone health. So it's something to consider with our patients with arthritis. And Tai Chi, again, sorry, can be helpful not just for the arthritis, but for the balance as well, since oftentimes the osteoarthritis is seen in some of our older patients. We talked about the risks of performing exercise. So I also thought it wouldn't be fair if we didn't talk about the risks of not doing exercise. So sedentary behavior. So overall, the risk associated with being sedentary, spending a lot of time sitting, is high. It increases your risk of these cardiovascular disease, diabetes, can even increase your risk of certain cancers. And I included this graph here because, again, it shows that daily sitting time compared to that physical activity, that there is this increased risk as one moves from this red, lot of sitting, not a lot of activity, to the green, not much sitting, lots of activity. It's just a nice visual representation of that. So it's important not just to remember the benefits of exercise, but there is actual harm from not exercising. So in general, some guidelines for safe physical activity, like we were discussing before, about starting low and going slow, gradually increasing over time to try to meet these guidelines. We'll talk a little bit about using appropriate gear and sports equipment and safe environments. As we were talking before about, making sure you know your physical activity level, your current level, as you progress with your therapies, your physical activity, so you don't progress too quickly. And those that have any chronic conditions that affect the heart, such as a history of prior heart attack, that sort of thing, it can be helpful to discuss with your doctor about what your specific goals would be, different from the general population. Warm-ups are the activities that are performed prior to exercise to get your body ready. These can take the form of many different activities, such as a stretching, a light jog, some resistance exercises, and those types of programs that are structured and include those general warm-up activities as well as sport-specific activities have shown that they can reduce the risk of injury, musculoskeletal injury. One example is the FIFA 11 Plus warm-up protocol that was developed some years back that showed that it could decrease risk of some of these soft tissue injuries, some of these sprains and strains. In general, for warm-ups, a good guideline for what the intensity of the warm-up should be is that you should have, some mild sweating, but without fatigue. The effects from the warm-up, the timing is important because it'll only last about 30 minutes. So you don't want to warm up and then, get distracted sitting do some work, whatever it may be, for an hour, and then try to jump right back into exercise. Effects of warm up, we get a lot of good effects to help the body prepare for the exercise and reduce our risk of injuries. So things like increased blood flow to the muscles, which increases our oxygen, increased circulation and metabolism. We get better muscle contraction and efficiency, some better speed of our nerve impulses being sent, decreased injuries and stiffness, increased heart rate gradually to prepare for the strenuous exercise. And we also see those effects on, kind of the anxiety, mental health, and cognition sort of things, where we get increased relaxation and concentration. Part of the warm up people often perform is stretching. There's a few basic principles before stretching. Warming up prior to stretch helps, as we talked about before, increase the elasticity, flexibility, that sort of thing of the muscles, increase the blood flow to them. We want to stretch before and after exercise, and gently and slowly. Oftentimes people talk about stretching and they feel pain when they stretch, and that you're stretching too much. You're straining too hard. You want to stretch to the point of tension, but not pain. So we'll talk about 3 types of stretching. One is the most common. This is the static stretch. This you can see in the corner over here. This will be a hamstring stretch, bending over, reaching for the foot, and having some mild tension along the back of the leg here. And that's all it should be, is mild tension, getting into this position slowly and gently, holding for half a minute to a minute. And this again should not cause pain. Ballistic is the setup is similar in that you're initially putting tension on that muscle, and then from there you're bouncing back and forth in that plane. So this type is really only seen in like gymnastics and ballet and dance, where kind of getting that full range of motion and the end range of motion, the movement at the end range of motion is important to them. It does have a potential increased risk of injury compared to some of the other stretch methods. So it's not one that I would generally recommend unless you were working specifically with, an athletic trainer or physical therapist, that sort of thing. And then the last one is a nice mouthful. It's proprioceptive neuromuscular facilitation. This you can see in the, again, the figure down here, the bottom corner. This would also be a hamstring stretch. You can see there is initially a passive stretch of the hamstring, and then there will be contraction of the hamstring against the shoulder right here. So you need a partner usually to do this. Then that muscle is relaxed, and the partner is able to passively stretch a little bit further. This is thought to produce greater flexibility compared to some of the other ones. There is a risk of overstretching for those that are either new to this or not doing it with someone that is familiar with how to do it properly. So again, this is another one that typically, if you're doing it, would be better either one, someone that's well versed in it, or 2, with an athletic trainer or a physical therapist. Another very important part of the safe physical activity and exercise and sport is protective gear and equipment. So anything that's worn by the athlete to protect a specific body part falls under that protective gear category. These are things like helmets, goggles, shin guards, pads, mouth guards. It's important to not alter, these pieces of equipment. They need to be appropriately fitted. And, sometimes we'll have athletes that the mouth guards, they'll cut them so that they're shorter, so that they don't go as deep into the mouth, but that reduces their effectiveness, of course. Making sure the mouth guard is appropriately fitted. So a lot of them need to be put into warm water first, and then to bite down to set them to your teeth pattern. Sometimes people don't know about that step. The different pads, especially in things like football, it's important to actually use them all. These days you see some of these athletes and their knee pads are the size of like a quarter. They're not actually covering or protecting anything. So it's important that we actually use appropriate sized equipment as well. In regards to sports equipment, things like the cleats, the shoes, the sticks, the bats, the balls, it's important that we're using the appropriate one for your either activity level, your age, your weight. So for instance, things like pole vault have a specific weight associated with that pole that is safe to use at. So you have to make sure you have one that's appropriately has the appropriate weight rating for you. When it comes to shoes and cleats, it's important that one, that they fit correctly, that they're not too tight or too loose. Two, you have to make sure that you're keeping up with maintenance of them. So if you see that they're starting to get worn out, that you need to replace them. A general rule of thumb for running shoes is between 250 and 350 miles on those shoes before you switch them. Because if you use them for too long after they're worn down, that could increase your risk of injury. And again, just using these pieces of equipment consistently and correctly, because if you don't use it, it's not going to protect you. There's many environmental factors to consider when thinking about sport and exercise. Some are just general environmental things to think about. So if you're, going for a run, making sure that there's some sort of physical separation between you and cars. So staying on the sidewalk, on walking paths, or if you're biking, staying in bike lanes, trying to be separate from the flow of traffic so that it reduces any risk of you, being struck. Neighborhoods with some traffic calming measures such as speed bumps or things like that can slow the traffic. Being in a well-lit, well-maintained area can be, very important as well. So you can see this nice, beautiful infield here. No large, divots in the grass that could cause uneven grass and risk for, that rolled ankle people commonly get when they play soccer due to uneven playing fields. You want to avoid, obviously, any potholes in where you're going to be running. So if you can find a school track, this has a nice kind of shock absorbing surface that will be better than, running on hard cement for the average, person. You can, through training, kind of have the body adapt to running on harder surfaces, but especially when you're starting out, the softer surfaces, shock absorbing surfaces are going to be a little bit better for you. Some things that I don't honestly see as much anymore as when I was growing up are those breakaway bases, those ones that are just basically placed on the playing field and are allowed to move and slide out of the way. The ones that we see a lot of times now, they have the hole in the ground and a post in the base, and it sticks it right in the ground, especially at higher levels. And there is a risk, of jamming the finger, causing an injury to the tendon if you're sliding in, head first with your hands out. On the flip side, if you're sliding in with your legs out and that foot gets caught and your knee hyperextends with those bases that don't move, just things to consider. And then, of course, padding to your goalposts and your goals, as well as anchoring them so that they are not moving and so that they're in their appropriate locations. In regards to the weather and the time of day, some important things to remember are that if you are running, outside on the road, that sort of thing, you want to be safe about it. So you want to be wearing reflective clothing, those strobe lights, either on your bike if you're riding or on your clothing so that you can be safe and seen. Using sunscreen when it's sunny out is very important. I don't know how well the paleness comes through on the camera. I'm sure it does, but you can see it's obviously a very important part of my life, using sunscreen, not just for the sunburn and the pain associated with it, but you want to reduce your risk of skin cancer. So not a risk that we commonly talk about with exercise, but if you're performing exercise outside, risk of that exposure to the sun causing skin cancer certainly exists. Avoiding the extremes of the heat and the cold and dressing appropriately, of course, is important. The heat specifically has a lot of issues, especially in the summer, especially with a lot of these folks that do either high into the vigorous intensity activity or are doing endurance type events. There's a very big risk of dehydration and heat stress that can be mitigated if we, take some time to adjust what we would otherwise be doing. So exercising earlier in the day or in the evening can reduce that risk. Exercising indoors, choosing a different type of activity. So instead of playing, basketball on the hot blacktop, you play, soccer in a grassy field versus even swimming in a pool. Reducing the intensity of the activity, taking more frequent breaks to rest and rehydrate. And one that people don't often know about is, if you're drinking caffeine or taking antihistamines prior to working out, that also can increase your risk of heat stress and heat related injuries, which range from, discomfort up to life threatening. So it's important to keep that in mind, especially if you're going to be out and exercising on a very hot day. And those that have any issues with the heart or the lung, it can be important to pay attention to those air pollution levels. These can be found by looking up the air quality index. A lot of the weather apps these days include the AQI. So in summary, the two biggest take homes, really, just to sum it up, are exercise is safe. Very, very few caveats to that. The vast majority of people, exercise is safe. Warming up is an important part of the process to help, as we discussed, with blood flow, reducing risk of injury, increasing your exercise gradually. So again, if you are going from an inactive kind of state to one that wants to participate in sport and exercise, increasing gradually is going to be important. Starting with the light intensity exercise and aerobic activity, graduating to the moderate, intensity exercise activity. And for many people, they don't need to necessarily get to vigorous intensity exercise, but if you do, again, doing it gradually is going to be very important to reduce your risk of injury. Using appropriate equipment, again, very important. Things like using the helmet. If you're following local law, is also important as well for these types of things. People have done studies to see what reduces injuries. And for instance, bike riding with the helmet. If you're skiing and snowboarding using a helmet, some certain states also have laws about that. And be mindful of your environment. Maybe don't, especially if you're newer and not adapted to the physical activity yet, maybe don't go out in the 100-degree humid Georgia heat in the summer and try to start running there. Try things at a lower level intensity, taking frequent breaks, dressing appropriately for those conditions. Exercise is beneficial for all. There's really no group that they've seen no benefit from exercise. Some of these effects are immediate. So those that have issues with sleeping, they have shown that same day improvements in sleep. Those that have issues with blood pressure, they've seen reduced blood pressure after exercise. Some exercises, some of these benefits that we see will increase as you increase your exercise. So keeping in mind that while any exercise is good for these benefits, so while any exercise is good for these benefits, that the more you exercise, the more benefits you will see. And then, of course, if you ever have any concerns about, if you can exercise or how vigorously you can exercise and all of that due to medical, issues that you have, you always just check with your doctor first, and they can kind of set some of those goals for you specific to you. Because that's, one of the tough parts is we can only give advice so general. Every person is a little bit different about those types of requirements. Some of the resources that we use for making this presentation, they're very good. That I'm going to see if I can pull over and just show you some of them on their websites. There's a lot of literature that, for the general population can be very helpful, especially for those with any specific medical concerns, like we talked about those that are trying to increase their exercise that have history of cancer or high blood pressure or diabetes. But yeah, it is through the American College of Sports Medicine. There's a lot of physical activity guideline resources through the Office of Disease Prevention, Health Promotion, and as well as the current guidelines from the CDC and the Department of Health and Human Services. They have a lot of, again, those chronic disease specific type activities that are targeted specifically for whatever it may be, such as, again, some of the more common ones like cancer, hypertension, diabetes, and pregnancy.
I would like to say thank you for joining us tonight. We kindly ask that you take a few minutes after tonight's webinar to complete the program survey. The link to the survey has been added to the chat for your convenience. A special thank you to Dr. Timothy O'Sullivan for dedicating your time and expertise this evening. If you have any additional questions or comments, you can send an email to communityhealth@atlantichealth.org or call 1-844-472-8499. That concludes today's webinar, and I hope you all have a great night.